At Carepatron, we are constantly looking at ways to improve. If you have any feedback on how we can improve our videos and resources, please leave us a comment in the comment section below. The hip joint is one of the most essential and complex joints in the human body, which is crucial for many movements and functions. Formed where the thigh bone or femur meets the pelvis, it's a ball and socket type joint that offers a wide range of motion. The joint is designed to withstand repetitive motion and a fair amount of wear and tear. It's enveloped by muscles and tendons, providing strength and stability to the joint. The hip joint is also surrounded by the synovial membrane, which is rich in blood vessels. This enhances the blood flow and nutrition to the joint structures. The membrane's fluid is also needed for smooth movements as it reduces friction among the moving parts of the joint. The hip is prone to various problems and injuries, severely impacting its proper functioning. Hip pain, often due to hip joint dysfunction, can manifest in multiple locations such as the back, front, and side. Here are some common hip pain causes: arthritis, hip fracture, bursitis, stress fracture, and physical and sports injuries. Healthcare professionals often use a hip pain location diagram to help identify their patient's exact source of pain. The diagram outlines the specific areas where pain can occur. The location of hip pain can provide valuable insights into its potential cause. Anterior hip pain. This type of pain is localized on the front side of the hip and can result from various conditions. Posterior hip pain. Pain in this area occurs on the back side of the hip and can stem from problems related to the lumbar spine, such as herniated discs or sciatica or deep gluteal syndrome, which affects the muscles and nerves in the hip or buttock area. Lateral hip pain. This pain is felt on the side of the hip and can be attributed to conditions like bursitis and inflammation of the fluid-filled sacs that cushion the hip joint, hip arthritis, characterized by the wear and tear of joint cartilage, or piriformis syndrome, where the piriformis muscle compresses the sciatic nerve. Carepatron has made a handy hip location chart to help healthcare professionals accurately pinpoint the source of their patient's pain. The diagram indicates the possible locations and corresponding conditions that could be causing hip pain. Our free hip pain location chart is free and fully digital. Here's how to use the template. Firstly, download the chart. Get a hip pain location diagram, which is linked in the description below. Print or use the digital format. Choose to print the chart or use it in its digital format. Use a diagram with patients. When your patient is experiencing hip pain, ask them to show you where they feel pain on the hip pain location diagram. You can use this information to narrow down potential causes and provide a more accurate diagnosis. Share with patients. You can also provide your patients with a copy of the hip pain location diagram to reference at home. This allows them to understand their condition better. Here's a sample of our hip pain location diagram to give you an idea of how you would use it in your practice. To discover more of our free templates, explore our templates library, which you can find on our Carepatron website linked in the description below. Carepatron is a practice management software known for its comprehensive features. Signing up is free. Just click on the link in the description. If you enjoyed this video, don't forget to press the like or subscribe button for more content like this.